have to continue an online session. In this edition also, primarily because weather's played spoil sport. So just a short note about the SCARF Award. This was instituted with the purpose of encouraging and acknowledging the services of responsible, committed journalists all across the country for their services towards mental health and to enthuse more people to take on reporting on mental health. And to announce this year's winners, we have one of the greatest scientific minds of the country, someone who was one of the people who has put India on the global map of research, Dr. Soumya Swaminathan. Welcome, ma'am. And a very good evening to all our dedicated jury, Dr. Jaya, Mr. Venkatesh, and Dr. Suresh Kumar. And I would now request Dr. Padmavati, Director of SCARF, to welcome the gathering and introduce the chief guest.
Thank you, Mangala. At the outset, I'm delighted to introduce our jury. Although I think over the last 10 years that they have been with us, we've said this again and again, but yet it's really my honor to introduce them. Dr. Jaya Sridhar, who's faculty at the Asian College of Journalism, is also a senior health media advisor at Internews. Mr. Venkatesh, who's the editor of Dinamalar, is also a prolific writer in Tamil, and he teaches journalism. Now, both of them have really helped us, help facilitate this award in to evolve to the state that it is in right today. And it's really our privilege to have known both of them over the past decade. Dr. Suresh Kumar, who's actually, again, a person who needs no introduction to this gathering. He's a psychiatrist and has special interests in the young. But to SCARF, he's actually family, and he is a person who's, he's expressed interest in whatever we have done over the past nearly 4 decades that SCARF has been in existence. So thank you, Suresh Kumar, yet again for being part of this journey, especially for this award. It's now my privilege and honor to introduce Dr. Soumya. Thank you, Dr. Soumya, for promptly accepting our invitation. I mean, I think probably this is the fastest that I've heard a response from any chief guest that we have heard. So thank you for that. Madam really needs no introduction to this August gathering. I'm sure as journalists, you all would have all read her works, reported on her, and read her reports and so on. But basically, we still have to, it is my privilege to talk yet again about her, about Dr. Soumya. She was most recently the WHO's chief scientist, and before that, the Deputy Director General of Programs, a pediatrician and a globally recognized researcher. And as Mangla said, has put us into the global map of healthcare research. She brings in 30 years of experience in clinical care and research and has worked throughout her career to translate research into action, into impactful programs. As the Director General of the ICMR in 2015 to 2017, she focused on, bringing science and health evidence into policy making and building research capacity in the country. She is widely published. And I think one thing that I've noticed about her writing was the crispness, which really reflected the in-depth knowledge in the subject. She is, she has several honorary doctorates, including the Karolinska Institute, EPLF Lausanne, and the London School of Tropical Medicine and Hygiene. She serves on several international and national global advisory bodies and committees. This is what her, the career path has been saying. But to tell her more from close home, she is currently the chairperson of the Dr. MSS Research Foundation. But she's recently accepted our invitation as an honorary member of SCARF. So thank you, madam, once again for that. She's been closely involved with SCARF's dementia program that again has brought in a lot of, global knowledge to the forefront as far as scarf is concerned. Thank you very much, madam, for being here once again. And it's really our privilege to have you with us today. Over to you, Mangla.
Thank you very much, Dr. Padma. And I think it's now time to move on to hear from the jury about what their experience was in this year's media awards. Just to give a background, we had about 52 entries this time, predominantly in English, and about some few articles, around 10 articles in regional languages, which again was predominantly Hindi. And I think the jury had deliberated quite some time to identify the winners this year. So I would now request the chairperson of the jury, Dr. Jaya Sridhar, to tell us about her experience of evaluating the articles this year.
Thank you, Dr. Mangala, and thank you, Dr. Padmavati, and such an honor and a privilege to share the space, virtual space here online with Dr. Soumya Swaminathan. We're so grateful that you have given us time for this, what we think is a very, very important initiative by SCARF. I just want to start by really paying a huge compliment to the Schizophrenia Research Foundation of India. It's not often that people as busy as them, experts who are on the front lines of delivering mental health services and studying the mental health landscape of the country here as well as abroad, and who's so busy, taking time to firstly consume the media and understand what the landscape of media reporting on mental health is. I think that's always the good place to start, just to get an understanding of what's out there in the media and recognizing the gaps and then stepping up to sort of acknowledge what's good about it, as well as highlighting, giving an opportunity to highlight the gaps and really motivating journalists to do a better job. During the COVID-19 pandemic, practically every journalist became a health journalist. And sometimes I ask myself, why that happened. And we saw pretty high quality of reporting as well during the pandemic, and not just from health journalists, even from first-time reporters who had not covered health before. And I think apart from it being timely, topical, and receiving a lot of editorial support and space on primetime TV news channels or the front pages of newspapers, I think the most significant contributor to the quality of health journalism that we saw during the COVID-19 pandemic, I mean, leave aside the whole ocean of mis and disinformation on the side, it was because people like Dr. Soumya and many of her colleagues at the WHO, I can think of the brilliant Science in 5 series and several experts from all over the world came regularly onto the television channels, made themselves accessible to journalists. And it was literally their words that were being echoed in the news media. And that's what really improved the quality of journalism. So all it remained, I think the major skills that journalists really picked up during the reportage of the COVID-19 pandemic was maybe not as much technical information and knowledge or an understanding of the data as we would have liked. I think it was mainly their ability to ask questions and not interrupt the experts when they spoke too much. Unfortunately, after the pandemic, we're seeing a decline in the visibility of health experts in the media. And we're seeing a decline in the quality of health journalism as well, which is why I said that it's fabulous that an organization like SCARF is taking the trouble to build those bridges with the media, not just during a time of emergency, but through the year, making themselves available for journalists, mentoring them, giving them some time, and really working with them, not using the media, but engaging with the media in a very sensitive and mutually respectful way. And I think that's how the career of a health journalist is built. It's built on a network of authentic sources and contacts who respect them, who recognize their work, and who are there for them in a time of need, who will supply the right data or clarify the doubt when it's time to file a story on deadline. Is someone from SCARF available? Dr. Mangla is always available. Sometimes journalists call me. So it's I think that particular bridge building exercise, which to me is the most significant, enduring, and very, very important and critical aspect of this whole award process. The second thing that I wanted to really highlight was that it's good that we got, more than 5 score entries this year. And one of the differences between the entries we got this year compared with what we got last year was, I think last year, the quality of, the quality of the narrative that really described experiences from the field, first-hand reporting from the field, capturing the community experience and capturing the day-to-day realities and challenges and the way people were coming to terms with their mental health conditions or what the caregivers were going through. That was very beautifully sort of captured in the entries last year. This year, we saw far fewer of those kinds of entries. And that's another trend that I'd really like to flag. We need less of desk-driven, internet researched kind of a journalism for mental health. We need far more people going and visiting the centers, sitting side by side, at the mental health service delivery, where that's happening, right there on the front lines, and really get a flesh and blood feeling. What is the spirit? What is the ambience? What are those people going through? Really capturing that and bringing it. And I think that's needed to move, not just, the budget for mental health or, a dry analysis of policy. I think before that happens, before the pen writes the check, you need to move the mind and the heart first. So it's got to appeal not only to the intellect, it's also got to appeal to our hearts, I think. Mental health is a very evocative and a highly emotionally charged area. And I think it really stands out from many, many other health conditions precisely. And I think it calls for an extraordinary degree of sensitivity and care when reporting on it, which is why I would urge the journalists who are logged into this session today to pay far more attention to fieldwork and really hanging out with the scientists and going down there to the field and really talking to people and talking to the caregivers and making the research and formation of your stories a much more immersive experience, so that quality, that emotion is captured in the words and in your photographs and your video. So may I say that this year's entries stood out for their, for the good way they reference data, and for their sort of special attention that was paid to, sort of referencing a number of studies. That's another really welcome trend. I've seen this in some of the other media for mental health awards also that I've been a part of. So there's an increasing trend that journalists are referencing stories from the, studies from the Lancet or referring to research much more often than they were. So I think really the challenge now is, how do you link the global to the local? I think that's really important, and finding out where it really matters. Is it really necessary to quote that study from South America for you to report on what's going on in Gummidikundi is my question. So I think making those connections and finding the relevance between the global and the local is very important. And for that, you need to speak to people. You need to speak to Dr. Padmavati, Dr. Tara, Dr. Mangala, Dr. Suresh Kumar in order to really understand that relevance, rather than just quoting studies for the heck of it. I think with those few words, my time is up. These are my major observations from this year, and I'm hoping that more and more journalists will apply for this award and put in the hard work and the diligent sort of attention to detail that we're seeing in the entries year after year. They're going to do it, and we're going to see more, exciting, evocative, and data-filled, as well as narratives with a human face next year. So I'd like to once again thank my fellow jury members, Dr. Suresh Kumar and Mr. Venkatesh, who I think it was a wonderful experience to learn from them, to work together with them, and also very, very grateful to SCARF for providing this platform and this space and time to promote the cause of good narratives on mental health in the mainstream media in today's age of mis and disinformation. And thank you also to Dr. Soumya for being a part of this. And most of all, to the journalists who've taken the trouble to research and do their stories and submit their entries to us. So it's not enough if you write your stories. Please do, alert us and keep us informed. Thank you very much for this opportunity, and congratulations to all the winners. Back to you, Dr. Mangala.
Thank you, Dr. Jaya. As always, I feel jealous of your students in ACJ. That was so interesting listening to you. And I think now Mr. Venkatesh is now available. So, sir, I think I would like to go with you. So, share your perspectives.
Yeah. Thank you for this opportunity, madam. This is
As a jury member, as the coach this year.
Yeah. Thank you for this opportunity. And I'm able to see a lot of difference over a lot of these number of years that we have been looking at this content. And the important thing that I see in this year is that generally what we always say is that we get a space for features, but generally we may not get a space for news items actually. And one of the things that we have seen in this year is that most of the stories are either news items or probably data is taken from different sources and probably presented to the larger audience. See, I always see that writing a large and probably in-depth features is equally important, and also reporting something which is very close to you, which is something like if it is something that happening in Jammu and Kashmir or some other places, there is a in-depth reporting which is not daily reporting or probably or a weekly column kind of a reporting. And these reports actually continuously keep the people engaged on the subject that is they are writing on. And that is a kind of I see from the from the magazines and the daily papers perspective. They are more willing to give that kind of a space to the journalist, and they are able to continuously keep the stories populating the stories on a regular basis. So generally what happens is in a news media houses is that generally these kind of mental health stories appear probably once in a week or once in 10 days kind of a thing. But this time I can see that there's a continuous space being given in the paper or probably on the online platform. They are able to continuously write these stories, and they are able to bring out all the probably even the smallest thing that happens in that particular area. This is one welcome thing which has happened in this year, and I can see that happening. This is the first time probably I can see that kind of a importance given to the news items. But at the same time, as Dr. Jaya was saying, that we are looking for more in-depth stories. We are looking for more probably field reports. And this time, that kind of a field reporting was much lesser. And the kind of subject that they have. Yeah, the other thing which I wanted to highlight is that this time the kind of subjects that the writers have taken up are very huge and probably varied subjects, and that is most important. And but they have not taken the probably the pain to do a full-fledged research, or probably something like the entire the taking up field reporting, and that kind of a thing has not happened this time. But now I'm happy that there is a lot of these Hindi stories have come this time, and regional media is once again giving a lot of importance to the mental health stories. Those are the important things that I think are important. And we are very happy that once again reading is a very pleasure, and I should say that every time reading these kind of stories is a very a very engaging thing. And this time we had Dr. Suresh also along with us. Generally we both of us used to read and probably take a call. This time we have an additional doctor who gave a lot of inputs onto this subject. So this was a wonderful reading. And this I don't know, first of all I think the reading material as such is the most important thing. I think that is well written, and probably that gave a very interesting. I spent almost 2 days in reading all the stories, and that gave me a very good insight. And one of the things is that many people have taken a lot of stories from the foreign sources. Yes, fine, that this is the kind of a story that we are also looking for, but probably take the idea and implement that into the local media. So local research, I think that will also add more value to the stories. So I think I am expecting more to happen in the next years, and more regional stories also should appear. I think those things should be given more importance. And as Dr. Jaya was saying, that we need more in-depth stories for these kind of awards. So I mean, more field reporting is what I look for. So I request all the journalists who are participating here to please take this as an encouragement, and please submit more and more good stories in the following year. Thank you very much, ma'am. Thank you for the staff for giving me this opportunity.
Thank you very much, sir. That was wonderful hearing from you. Yeah. So I am able to recall all that we deliberated during the jury meeting. So nice to hear you recall all of that. I think we can now have an expert opinion from Dr. Suresh Kumar regarding the mental health content of the stories that we submitted for the awards.
Thank you, Dr. Mangala. So, first of all, let me begin by congratulating the media journalists for their time and space that is given for mental health, an often neglected field. So, I was able to read the 52 stories, news features, and reports mainly because of the opportunity provided by SCARF to me. This is absolutely privilege on my part to be part of the jury, because I think for me, it's not just reading those 52 articles that was there, which I would have never had an opportunity to do, but I think interacting with Dr. Jaya and Mr. Venkatesh and looking at from the perspective of the journalist was very refreshing. And I would say this is a very learning experience for me. The insights I gained by the interaction with them, as well as reading through the stories, is immense. So I was actually surprised at the diversity of topics that were covered. I was actually thinking that they would cover a narrow issue, but I think they were covering wide range of topics in the reports, which is a very welcome thing. But I think they're also difficult for us to compare and contrast, because there are apples and oranges, because there were stories, there were news reports, there were features, and there were very short things. So, but I think on the whole, I would say that, I would echo what Dr. Jaya was saying, that I think it's very important for journalists to be science-based and be accurate, because they're presenting a very complex issue like mental health. Often you can be prescribed, things which are completely different, or talking about it in a very mystic way. I thought most of the articles were science-based and rather accurate. So that's a positive thing. So I think, can somebody mute?
Sir, I'm sorry to interrupt. Can go on mute? There is a lot of disturbance in the background.
Yeah. I don't know where the noise is coming from. Is it better now? Where is it coming? It's not. Okay, I'm sorry about that. I don't know. It's not coming from my source, I guess. So I was just wondering, as a mental health professionals, I have a request to make to people who are here as journalists, because I strongly believe media and journalists have the power to shape the public in their attitude towards mental health and illness. And certainly they can help to mitigate stigma, which is the biggest barrier in mental health. And having said that, some of the reports rather look to me, even today, quite dramatizing. And I think particularly when it comes to suicide, that's when the stories become a little bizarre. I think some of the things relating to mental illness is exaggerated and talked about. I don't really think it serves a purpose. It may serve to increase the stigma. My request is all the journalists must probably adhere to the Press Council of India's guidelines, which is there very clearly. That would be helping in reporting something on a very sensitive topic like suicide. But I would think there are some of the things in future people can think about. When we talk about mental health, which is a very complex issue, people often only narrow down to one particular aspect, namely only illness, and focus on the illness and perhaps the treatment of it. But if you think about mental health is a continuum, we have promotion, we have prevention, we have early interventions, we have treatment and care, like any other medical disorder. And I think if people can think about that continuum of care, that will really help people to understand a complex issue like mental health, and it may serve the purpose very much better. Second, I think you have a duty and responsibility to humanize mental health and mental illness. And Mr. Venkatesh was talking about stories. The stories are very important. I think the stories from three key people with lived experience, and people who provide care for them from the family, and those who provide treatment and mental health services. These are the big three people, and the stories from them can be very powerful and can serve to really alter the narrative around mental health. And I think there is no better way of picturizing and portraying mental health than by actually humanizing the mental illness, because which is what is required at this point in time. But I always believe, if you look at the winners, you would ask why that particular person is a winner. And I think we all believe very strongly, as all the three of us believed in this very strongly, we need to convey positive messages. I think in a very complex disorder, which is very much ill understood by the people, the one thing that we are looking for is hope. And I think hope is very, very important for people with the illness, people who provide care for them, and also people who provide the treatment for them. To the whole people, I think the hope is very important. And I think stories of people who have recovered from illnesses, stories of people who are usefully occupied, stories of people who are going out and helping other people with similar lived experience, those are very powerful stories that gives a different image about mental health itself. Because often we think about mental health as a story of, like decline and deterioration and, apathy and, so I don't think it's all like this. It's only a small part of it which could probably reflect that. A large proportion of people have a very positive story to offer. And I think media can also help to facilitate access to care, because in a country, many people are seeking help at this point in time, but they're seeking help at a later stage. I think early interventions are very important, and access to care and connecting with them can happen through the press service by actually highlighting the number of mental health services, the range of mental health services available with the government and the non-governmental organizations, and even in the private sector. Lastly, I would also think, after all, as a person, as a public health professional, I'm also interested that the messages that you provide should be of importance to public health. And I think the way you'll portray the information in a very simplistic way, a complex research finding can only be understood by scientists. But I think if you have the power of, not everybody has the power of Dr. Soumya Swaminathan in translating big research findings to common people. But I think journalists have the power, they have the ability to do it. The way they articulate things are sometimes, very important for all us to consume that research findings into translatable data from the public viewpoint. So I only request people to do it. Thanks once again to SCARF for having me on board. And I think once more, I would like to join Dr. Jaya and Venkatesh the next year, mostly to learn from them, because they are very rich in the way they interpret the articles and the richness with which they have analyzed it. It was a treat to work with you, sir, and Dr. Jaya. It's a pleasure. Thank you very much for SCARF for offering this opportunity.
Thank you very much, sir. And you can rest assured, you are never going to leave the jury as long as the media awards exist in SCARF. You're there to stay. And I think I was transported in time to my college days when we used to listen to you in class in the IMH. And it was wonderful hearing you talk in the same way as you talk about mental health, mental illnesses, and about public health, and for journalists as well. So I think it's now time to move on to hear from the chief guest of the day, Dr. Soumya Swaminathan. Madam, if you can address the gathering, and then at the end of it, announce the awards for the day. Over to you, ma'am.
Thank you, Mangala. Thank you, Padma, for the invitation, and many thanks to the jury. First of all, thanks to staff, I think, for having thought of setting up these awards and doing them for many years in succession. And also thanks to the fantastic jury. And we've heard from several of them, as well as Dr. Suresh, about the quality of the articles, about how things have perhaps changed over the last few years, and also how what could be done in the future to make it even more impactful, and what kind of stories and what kind of data they could use actually to take to the public. So I mean, there's goes without saying that mental health disorders are on the rise. This was partly also the impact of the pandemic, but of the many other, I think, shocks that people are facing these days in terms of economic shocks, as well as climate conflict, etc., not just in India, but around the world. And surveys have shown an increase in mental health disorders, particularly among the young. And so I know that the Indian survey was done many years ago now. I'm not sure that there's been a repeat national mental health survey. Of course, it's not easy to do these national level surveys, but I think the last one was 2013. And that showed already that 13 or 14% of our population had majority of them, depression or anxiety. But we also see a growing burden of dementia and age-related illnesses, and also childhood, I think, problems which again arose from isolation and also in some cases domestic violence, abuse in children during the pandemic, and the impact of internet, social media, and the whole growing area of addiction to internet, particularly among children, and also the abuse, online bullying, online kind of things, which we're still, I think, beginning to understand what sort of impacts those are having on children. So there are new areas in mental health as well that still need a lot more research, a lot more understanding, and more communication to the public as to what are the acceptable limits for a child to be online. How do you keep, and there are WHO guidelines as well on screen time, for children of different age groups. And what is, one thing is screen time, of course, that could include watching television and things like that. But if children are given space to explore the internet, then what are the do's and don'ts? And how do you start recognizing early on that there's a problem, that there is addiction, or that there may be cyberbullying or something else going on? I think even for us, experts, it's very difficult to figure out some of these things if it's happening within your own family. Similarly, there are on the other extreme, the problems of the elderly that may or may not be associated with dementia, but there are mental health issues to be looked at there. And it requires also a lot of training, capacity building among the caregivers, family members, and a whole cadre of people now to be trained in the community to take care of such individuals who may be living a much longer lifespan, but with a whole host of problems that need care. So I think there's also this need now to develop a cadre of people who are trained actually. And I have seen the power of having someone who's a trained caregiver take care of a person with mental illness. It can make a big difference actually to quality of life of that individual and also the quality of life of the family. And staff is doing a lot. I visited their dementia center, and Dr. Sridhar has done an amazing job of setting that center up from scratch, along with, of course, help of Dr. Tara and Padma and all the others, and a lot of people who've given the house and funds to construct that building. And it's really playing a very important role in society to take care of dementia patients who cannot be cared for by families at home. It is a huge burden, both financial as well as emotional burden on families. So, as we try and get a handle on some mental health problems, and we think we're making progress, there are always further challenges that keep coming up. And I don't think society can ever be free of this. So the things to do obviously are, as have been spoken about by the other speakers before me, to address the stigma and discrimination. That's still, I think, a very big issue. Media plays a very important role, and we've had some fantastic films, for example, that I've seen, done by Dr. Mohan Agashe and others. And of course, staff was also a pioneer in the film festivals, mental health film festivals that they have been doing for many years. So that again goes a long way in building awareness amongst the public, and done in handled in a sensitive way. It, as Jaya was saying, it appeals to our emotional feelings, not hard intellectual facts, but you learn to connect with and understand what a person with schizophrenia, what a person with depression would be actually facing, feeling, and how to deal with that. So I think we have a long way to go in terms of the society accepting and being willing to deal with this. Workplace issues is another area. How do you deal with colleagues who may have mental health issues in the workspace? How do you help them? How do you deal with them sensitively and at the same time keeping up the organizational morale and things like that? And then, of course, research into models that are more applicable to India, that are not so much, institutional dependent or pharma based or a drug based model, but really a community interventions that can help address most of the mental health problems that are still at the mild level, initial stages, and only refer those that need care. So we know that many NGOs have been working in this space, that there are models that have shown success, even in randomized clinical trials, but the challenge is scaling them up. So one could go on and on actually about what are all the things that need to be done. But I think here what we're really talking about is media, particularly, I think the vernacular media, writing in the regional languages in a way that people can understand and identify with and appreciate. I think they're doing a very big service. So I'm very happy. And that's why when Padma wrote to me, I sort of immediately said yes, because firstly, I have a lot of regard, respect, and affection for staff and the work they do. And I think that journalists who are writing about these topics and issues, we used to do a similar thing for TB. I think Jaya is very familiar with the REACH awards that were given to the journalists who wrote on TB, particularly again in the vernacular press. And now we've also launched through the NSSRF, the Soumya Swaminathan Media Fellowships on gender issues. And so every year we select 3 journalists, one in Odia, one in Malayalam, and one in Tamil, to encourage them to write stories related to gender. Could be agriculture or could be any aspect of development, but focused more on the actual programs that have shown some success or highlighting some challenges perhaps that need to be addressed by policymakers. So I think all of these, we need more of such initiatives, I believe, really, that are taking science, research, evidence, data to society in a way in which only journalists can translate. I think technical people and scientists are not very good in doing that. So we need the journalists to actually take those stories and put them across in a way that make it appealing for people to read and identify with, and hopefully to take action on. So I'm very happy that we're honoring these awardees today. So back to you, Padma. I want to congratulate each one of the people who are getting the awards today.
Madam, we would now like you to announce the awards.
I can't find that. Yes, can you just remind me? I was looking for that email. Did it come from you, Mangla?
Yeah.
Why don't we flash it up, Dr. Mangla, then Dr.
Yeah,
Soumya?
that may be easier. Yes.
Okay. Yeah. Just a second. We are sharing the screen.
Okay.
So this is
So
for the
first
regional category, madam.
Yes. So Mr. Prem Vijay Patil. And this is awareness is important. Psychiatry is still considered insanity. the roots of superstition come from here. And this is, he writes for Nai Dunia, right?
Yeah. Citation.
Where is Mr. Vijay Patil?
Yeah. Dr. Jaya, you can read the citation, please.
Sure. So proud to be able to read out the citation for you, Prem. I mean, I think this is remarkable that you've continued to show such an interest in covering health, and very, very pleased that you have won this award. High quality journalism plays a key role in informing the public about mental health and helps remove stigma and discrimination against people living with mental illnesses. And the Schizophrenia Research Foundation India lauds the efforts of diligent, hardworking journalists in promoting awareness on mental health. SCARF proudly recognizes the outstanding efforts of Prem Vijay Patil for his timely, well-reasoned report on how stigma and superstition around mental health stymie access to services. His article titled Ranjana Jaise Manoragi Tantrik Ke Chakkar Mein Upchar Ke Diare Mein Lana Hoga. I'm doing a bad job of pronouncing the Hindi, sorry. Published in Nai Dunia, 3rd March 2023, reinforces the importance of mental health awareness and care as the need of the hour. We're so delighted to award you, Prem, the 2023 SCARF Media for Mental Health Awards for excellence in reporting on mental health. Congratulations and God bless you.
Thank you.
Mr. Prem Vijay, would you like to say a few words?
Yeah, ma'am. Can I speak in Hindi?
Yeah. I think most people will be able to understand. Please go ahead, sir.
सबसे पहले मैं आप सभी को जूरी मेंबर्स को और स्टाफ को मैं धन्यवाद दूंगा, क्योंकि मैं मध्य प्रदेश के आदिवासी बहुल धार जिले में पत्रकारिता करता हूं और झाबुआ, अलीराजपुर ये ऐसे आदिवासी बहुल जिले हैं. दीज आर द ट्राइबल डोमिनेटेड डिस्ट्रिक्ट, और जहां पे अशिक्षा और ये सारी समस्याएं हैं, वहां पे हेल्थ को लेके इस तरह की इश्यूज पे मैं लगातार ग्राउंड लेवल पे काम कर रहा हूँ. तो मुझे लगता है कि ये अवार्ड मेरे लिए एक एप्रिसिएशन है, मेरे लिए प्रोत्साहन है, ताकि मैं आगे और अच्छा काम कर पाऊँ. और लगातार मुझे डॉक्टर मंगला है, डॉक्टर जया जी है, अन्य सभी जो मेरे मार्गदर्शक हैं, उनका मुझे गाइडेंस मिलता रहता है. So I am very thankful to SPARC, and I express my gratitude to respected jury and the SPARC, and this is my commitment to you. I'm trying to be voice of these people. I think a lot of work still needs to be done on mental health. So thank you again to all of you.
Thank you very much, Prem. I think you have been doing wonderful work in mental health for a long time, and we have been seeing you doing consistent work, whether it was part of a fellowship or outside the context of fellowship. We have always understood that you're passionate about reporting on mental health and doing something to improve awareness in your area. Thank you so much, and please continue your good work.
Thank you.
Yeah. So the next one is a special mention in the English category, madam.
Yes. Dr. Ajaz
Yes.
Ahmad Suhab. Change Your Mind About Mental Health. Written in Rising Kashmir. Dr. Ajaz is there?
Yeah.
Yes, ma'am.
Just a minute, we will get your citation. Yeah.
Congratulations, Dr. Ajaz.
Thank you so much, ma'am. Thank you so much.
Yeah, so pleased to be able to read out your citation, Dr. Subha. Can someone mute their mics, please, so that we can respect the reading of the citation for Dr. Subha? Thank you. SCARF proudly recognizes the efforts of Dr. Ajaz Ahmad Suhaf in his nuanced reporting on public perceptions of mental health. His article titled Change Your Mind About Mental Health, published in Rising Kashmir, calls for a perceptual shift in treating people living with mental health conditions and in supporting them to gain access to mental health services. We're absolutely delighted to award Dr. Ajaz Ahmad Suhaf the 2023 SCARF Media for Mental Health Awards for Excellence in Reporting on Mental Health. Congratulations, Dr. Suhaf. And over to you.
And Dr. Jaya, I think we need to also mention here that we had a separate category for mental health professionals writing in print media. We used to get a lot of entries that way, and we decided to start a separate category for that. Unfortunately, this year we didn't have too many entries, which is why we have included Dr. Suhaf's writing as part of the general category itself. Over to you, Dr. Suhaf. You please unmute yourself and you can speak. Dr. Suhaf? Hey, I think you have to unmute it. Okay. There is some problem there. We can move on. The third prize in the English language category. Please flash.
Hira Azmat. Hallucinations, crying spells, suicidal tendencies. 1 in every 7 new mothers suffer from postpartum depression in Kashmir. Written in the Kashmir Monitor. Congratulations.
Thank you so much. Thank you.
Yeah. Once your citation is read out, we can hear from you, Hira.
Very good work. Hira, absolutely enjoyed reading all of your entries, all of us on the jury. And I think this was a very good article, and we absolutely enjoyed reading it. It touches on something which is not widely reported on. So thank you for flagging that. Just waiting for the citation to come up.
Yeah.
This is Hira's citation. We proudly recognize the outstanding efforts of Hira Azmat for her engaging report on postpartum depression. Her article titled Hallucinations, Crying Spells, Suicidal Tendencies, 1 in every 7 new mothers suffers from postpartum depression in Kashmir, published in the Kashmir Monitor, brings to light the plight of new mothers in the cloud of stigma that impedes access to mental health in Kashmir. We are so delighted, Hira, to award you the 2023 SCARF Media for Mental Health Awards for Excellence in Reporting on Mental Health. Congratulations, Hira, and over to you.
Thank you so much. I'd first like to express my heartfelt appreciation to SCARF Media for the commitment towards promoting mental health awareness through this award. And this recognition will definitely hold a very special place in my heart, because it not only reflects my personal dedication towards mental health advocacy, but this award will further, help me to continue. It will kind of inspire me to continue my efforts towards making a positive impact through the stories in which I can further challenge the stigmas and promote health-seeking behaviors, which will further help me in improving the mental health well-being of individuals in my society. Thank you. Thank you once again.
Thank you very much, and congratulations, Hira. We now move on to the second prize. It's Miss
Minnie Thomas. This is Miss Minnie Thomas. Early childhood stimulation is crucial in child's intellectual development. And this is for the week. She's the health reporter for the week. Congratulations, Minnie.
Can we have the citation, please?
And while we're waiting for the citation to come on, let me mention that Minnie has been doing a lot of excellent health reporting in the week, covering not just mental health issues, but a range of other public health topics, which are, very well written, always diligently researched, always data backed. And I love the human face she puts on her story. So this one was a particularly good read, very in-depth work, and I could see that it was a labor of love as well. So congratulations, Minnie, and so happy to be able your
Dr.
side.
Jaya, I think Minnie is not a newcomer to the Scarf Media Awards. She has been a consistent winner for several editions before, and for some time she was out of circulation, and I'm so glad she's back this time with more than one entry. Welcome, Minnie.
Thank you, ma'am. So Scarf has always encouraged and motivated
Yeah.
me.
Dr. Jaya, the citation is on.
SCARF proudly recognizes the outstanding work of Minnie Thomas. In her in-depth report on cognitive development in children, her article titled Early Childhood Stimulation is Crucial in Child's Intellectual Development, that was published in The Week, sensitively sketches the importance of early childhood stimulation and its positive effects on cognitive development in children. We're so delighted, Minnie, to award you the 2023 SCARF Media for Mental Health Awards for excellence in reporting on mental health. Over to you, Minnie.
I hope I'm audible.
You sound a bit muffled.
Not audible.
Yeah.
Yeah. So I have huge respect.
Minnie, your voice is still very muffled, Minnie.
Okay. I have huge respect for Dr. Soumya. I have been able to interact with her several times during my 15-year-long career. I wish I could receive this award in person from her. SCARF has always encouraged and motivated me to do impactful mental health stories, stories that need to be told. I thank SCARF for all the encouragement and support, and I also wish this opportunity to congratulate the other winners. Thank you.
Thank you, Minnie. Yeah, we also wished it could have been an in-person event this year, but sadly it couldn't happen that way. Maybe next year. Right? Yeah. And we move on to the first place.
Okay, so we have Urvashi Sarkar, bipolar disorder, the group changing attitudes about the condition, from the BBC. Congratulations, Urvashi.
Thank you.
Urvashi, just on behalf of the jury, why we particularly loved your piece was this is again, as Dr. Suresh Kumar was mentioning, and as Venkatesh was also mentioning, it's really important to show that the peer-to-peer support, or the importance of communities' resilience and their own innovative and creative ways that they can support each other. And it's not all the time about a top-down, receiver of services, from the mental health professionals, but it's also possible to do other getting back. This is the recovery phase that Dr. Suresh was talking about. This is a really important development that's been covered, and hopefully it's a positive story and a positive example that will give ideas to other people who are trying to come to terms with living with their mental health condition. Support groups are a very, very key aspect of getting well again. So SCARF proudly recognizes the meritorious contribution of Urvashi Sarkar in her reportage of an online support group that works to destigmatize and offer psychosocial care for people living with bipolar disorder. Her article titled Bipolar Disorder, the Group Changing Attitudes About the Condition, that was published in the BBC Online, brings to life how a community can come together to provide care and support for each other. We're so delighted, Urvashi, to award you the 2023 SCARF Media for Mental Health Awards for 2023. Over to you.
Thank you. So I just have a few words to say. Congratulations to Azmat and Minnie for their very interesting stories, which I'm going to read later on. So I'll just quickly give the background to this story. Depression is being spoken about a lot more these days. We have sportspersons and celebrities and public figures speaking about their struggles with mental health, but everything is swept under the broad, generic category of depression. And we as a society are uncomfortable to name and also acknowledge the most serious forms of depression which people live with. And somebody very close to me is affected by bipolar disorder, and I saw her struggle with it, and her caregivers, her parents struggled with it, and I sensed that they were very alone. And I really wondered if there were communities online or offline which were dealing with people who had similar concerns, people and their families. And that's when I happened to come across the Bipolar India, um, and I just participated in a meeting of theirs just to see what was happening. And when I attended the meeting, I was struck by the hope and the positivity and the optimism of everyone over there, and how they shared their struggles and their challenges, and also they shared resources, and they have very vibrant WhatsApp groups and a Telegram community and online chapters. So I thought this group is Bipolar India is doing commendable work, and I think the founder, Mr. Vijay Nalawala, is here today. So this award is really to the community and to their struggles, and because their lives are the most difficult, and as well as the caregivers, I think they really, really struggle on an everyday basis. So thank you for acknowledging my work, and I hope to report more on such issues.
Thank you, Urvashi. I think your speech was as impactful as the article you had sent. I think it underlines the humaneness that was part of your story. Thank you very much for that article, and keep continuing to do the good work.
Thank you.
Yeah, I think we have reached the end of the session, and so it is now my pleasant duty to deliver the vote of thanks. Unless, if I may ask, Mr. Vijay Nalwala, you are here in the meeting. Would you like to say something?
Thank you, ma'am, for this opportunity. Firstly, delighted that work related to community has been sort of brought under the spotlight so well by the article. Urvashi covered it with a lot of heart, with a human angle rather than it being cold journalism, bringing all the experiences of peers and the people from the family carer segment as well as the persons with lived experience and how the community is so well bonded together. And congratulations to Urvashi, and of course to big thanks to SPARC for initiating this series of awards that recognizes such a stellar work in spreading the message of mental health awareness and advocacy. Thank you so much.
Thank you very much, sir. So it's now my pleasant duty to deliver a vote of thanks before we close this edition and wait for the next one to come up in October 2024. Yeah, so I would begin by thanking our chief guest, Dr. Soumya Swaminathan, for accepting our invitation very quickly, and who went through all the articles, and she also gave us a very informative speech. She highlighted the importance of community level interventions and the role of media in building awareness and to break the stigma, and the never ending problems that are coming up with changing lifestyles and growing technology. And she covered the works, the entire range. And I think people will listen to you more, madam, because you are a person that journalists are willing to listen to. And I hope this gets carried to more people. And I think I'm not sure if I should thank the jury, because they are now part of the SCARF family, Dr. Jaya, Mr. Venkatesh, and Dr. Suresh Kumar. And it was a pleasure working with all of you as part of this jury. And thank you once again for sparing your time despite your ever-increasing schedule. I know Venkatesh and Jaya, you have been extremely busy, and Dr. Suresh is never easily available, and it was a miracle we were able to get him in a very short notice. Thank you very much, all of you. And I think this would not have been possible without all those journalists who sent in their entries. I think your interest, involvement, and passion to cover about mental health is what is going to keep this award going forward, and that is what kept us alive for 10 years now. And we hope to see a better version in the coming years with more regional language participation, and preferably from Tamil. I think every year Venkatesh definitely brings it up that we are not doing enough to cover the Tamil language in articles, and then we honestly don't know how to go about doing it. Especially post-COVID, all the health magazines in Tamil seems to have been closed down. So if we have to rely on only the regular articles that are getting published in the newspapers and online versions. And I think the audience, thank you very much for being here, because without you, it would have been a very, very morose kind of event. And thank you very much. And we definitely hope to see you all in person in the coming years. And before I close, I would like to announce that SCARF is offering a fellowship for 6 months for mental health reporting every year. So if any of you are interested, please do contact us. You can contact me, or you can write to info@scarfindia.org, and we will definitely look into it and respond. So that is one thing. And please encourage youngsters, if there are anybody who's interested in understanding mental health reporting, SCARF offers a course free of cost online on mental health reporting. So we will be happy to accommodate them if they make contact with us. And last but not the least, I think I have to thank Dr. Padma and my team, Ms. Subhashini Venkatesh and Tamil Amudan Shekhar, who have been doing all the technical work to make this event go on flawlessly. Thank you so much, everybody, till we meet again in the next edition.
Thank you. Thank you to SCARF. And congratulations again to all the winners. Bye-bye.
Thank you, madam.
Maybe we should have the photographer, we'll have a photograph